And the next speaker is from Vietnam, so Dr. Zontu. Yeah, invite Dr. Zontu. Okay, are you there? Okay. She is a lecturer of the public health in the School of Medicine and Pharmacy in Nguyen University.
Yeah, well, thank you, Professor Neo, for inviting me. It's my honor to be here today to have a short presentation about community response to COVID-19 pandemic containment measures in Vietnam. In my speech, there are four main parts. First one that is the situation in Vietnam. The second, community response to infection control measures. The third is negative impact of containment measures, and the last one is country unity. First of all, I want to show you the situation of COVID-19 in Vietnam. Vietnam currently has been assessed to be a successful model of coping with COVID-19. The first case was found on January 23rd, and also although has border with China until now, there were just 349 cases in nearly 100 million population. And today, Vietnam entered more than 60 days without new community infection, and recovery rise to over 83% with no reported death. And as you can see from the timescale, Vietnamese government acted quickly on the early signs of COVID-19 because of having rich experience responding to SARS in 2003, the same in Taiwan, avian influenza and other epidemics. Moreover, the population is much more respectful of infectious diseases, and the research has been to greatly minimize the outbreak. And so the containment measure in Vietnam, what are we doing? Similar to Japan, India, or other countries, it is a combination of an early lockdown and social distancing, increasing in variety of health information, government financial aid regulation, and some prevention regulations such as wearing masks in public, washing hands, avoid meeting and gathering. They have been the effective ways to cope with this deadly virus in Vietnam. Well, about the community also has the different ways to respond to these measures. According to the latest research of community response in Vietnam, it including over 2,100 respondents throughout the most provinces in Vietnam. About personal preventive measures, a very high proportion of Vietnamese citizens follow infection control measures, especially wearing masks. Unlike citizens in some countries that discriminate against masks, Vietnamese people wear masks because of the high reception, and the culture of wearing masks has been as normal as way to protect themselves. Not only medical staff or patients, a major of Vietnamese people have a habit of wearing masks to cope with air pollution or sunshine. And about the community preventive measure, under the force of government and of course the community perception, nearly 100% of Vietnamese people implemented the right practice. Several cases who resisted the regulations have been punished and deterred for everyone. And however, half of the participants have resisted the press market because of the habit. And in addition, most companies and organizations have applied unprecedented working methods to promote working from home. And people advised to stay at home as a patriotic act and only go out when necessary. So about the response to communication measure, the Vietnamese government has approached its public communication with a striking level of transparency. Starting in December, the communication campaign had run daily on TV, mobile phones, and other social media. In terms of responding to communication measure, most of Vietnamese obtain the COVID information through official sources such as state TV or Ministry of Health website. And until the mid of March, more than $1,040,000 of mobile apps inquiry, and according to Ministry of Information and Technology, about 6 billion messages have been sent to Vietnamese citizens to raise their awareness about hand washing, self-quarantine, self-checking health, etc. And the washing hand song is made by collaboration of Vietnam Ministry of Health and musicians, which attracted nearly 50 million views on YouTube. It immediately went viral globally and was broadcast on American and European channels. Thousands of health declaration forms, including paper and online forms, were filled to follow people's situation. Well, however, the containment measures has also have a negative impact to Vietnamese citizens. Affect the social distancing on people, job, and life. Some studies show that 6.1% of citizens experience the difficulty in obtaining food, and most of companies got the negative impact, and high unemployment rate increased 0.07% than the same period last year, and of course decrease their income. And medical staff also suffer from many types of psychological symptoms, especially 1.9 increase in person reported suffering from violence and discrimination. Well, and finally, the campaign of fighting COVID is not the sole duty of government. It is a from community as well. According to the Global Health Faculties, which cover over 32,000 respondents in 45 countries, Vietnam earned the highest national public trust globally. It strongly proved that most Vietnamese people completely believe in government and health system that they could win the pandemic. And in addition, the country's unity is also an essential part of defeating novel coronavirus. The whole Vietnamese community with many classes have participated in different types of contribution. And more important, it is the sense of community that makes things work, as Vietnamese inhabitants strictly follow the government instruction and regulation. Fighting the epidemic is like fighting against the enemy, said by Vietnamese Prime Minister, and is the reason why Vietnam can control well the COVID-19 pandemic. Well, thank you for your attention, and I hope to hear it from you in the discussion time. Thank you.
Thank you, Zeb. Thank you very much, Zongtu. Thank you very much. Yes, it is very interesting to learn that how the trust between your community and government leads to the success story. And many people are very feeling amazing with the response in Vietnam.